Okay, bipolar, video 4. Now this is a long one, and let's get started with it. Medications for bipolar. One source clears it up remarkably and says medication can be like a pair of glasses. Bipolar disorder distorts your view of things. Medication may allow you to see it clearly again. People with bipolar disorder tend to have high relapse rates. This is because of they can fall into old habits, they can have alcohol or drug problems. However, most interesting factor involves the word anosognosia, which I'm probably pronouncing wrong. It's an illness where the individual is unaware of their problem. Commonly, they think that they are okay or cured, and when they stop taking the medication prescribed by a doctor, manic episodes or mood swings can easily occur. As one source places it, anosognosia, or lack of awareness or illness, thus has an anatomical basis and is caused by damage to the brain by the disease process. Now, that's saying it poorly, but I believe I know what it's trying to say is that the bipolar disorder is producing this, is changing the brain and producing this effect. Two primary medicines we will discuss seem to be unusually progressive in fighting bipolar symptoms. These two medications that claim prestige are lithium carbonate oral and Seroquel. Quantapine, or Seroquel, the Quantapine is generic for Seroquel, is actually the number 2 most prescribed drug for bipolar, beneath lithium. But for this example, we will stick to Seroquel and lithium. They address two things, but are entirely, they're sort of in different fields. Lamictal is the 3rd most prescribed drug for bipolar, and following it in chronological formation are the prescriptions written for Risperidol and Topamax. Topamax is written more often because it has a less drastic problem with gaining weight. In fact, I've actually seen some doctors use it as a way to stop people from gaining weight. Patients' top 2 favorite drugs for treatment bipolar is Lamictal by a majority. Now this is just this is just what people prefer. It's not saying that it's the best. Nevertheless, despite its overwhelming effectiveness, Klonopin is obviously favored because it is abused and addicting. We're not going to even go into that because there's other videos that go into that. Lithium is commonly used for bipolar symptoms. It takes approximately 2 weeks for it to get into a person's system. It is used to control mood swings and manic behavior. Lithium, as one source says it, is one of the most studied medications. It actually is the most studied medication. Lithium is a salt and is one of the elements of the periodic table. It's part of the table of periodic elements. It's represented by Li. Many forms of lithium are high in toxicity, but lithium carbonate is heavily effective in many patients when taken appropriately. Studies show that it lowers suicide rates, may deliver relief to those who suffer from substance abuse, and is a good treatment for preventing mania, although it not as effective as preventing bipolar depression. Oddly enough, it decreases norepinephrine. Lithium decreases norepinephrine and raises serotonin. Now, selective serotonin reuptake inhibitors, which are SSRIs, or the first monumental SSRI, Prozac, raises serotonin. Now, why lithium doesn't have the same effect is kind of interesting. It just shows you how sketchy some things are. Okay, a lot of information here. Let's start with the left. Lithium can cause a slew of problems such as dehydration, given that it is a salt, elevated white blood cell count, which is the most devastating problem, and they draw blood for that at hospitals to make sure that your white blood cell count is right. Dry mouth and frequent urination. Leukocytosis, I'm not pronouncing that right either, also known as high white blood cell count, reacts in ways that the body might respond if, per se, you had a fever. You do not want too many white blood cells, nor do you want to deplete them. Now, with lithium, what it does is you can actually take so much lithium that it will kill you. Yes, bipolar patients are 10 to 20 times more frequently connected to suicide rates. Lithium studies show show outdo all the new drugs, and it is even 2.2 times more successful at counteracting suicide than a newer completion Depakote. Depakote is a newer drug, and now given lithium is much more highly studied and been around much longer, but it's still 2.2 times more successful at preventing suicide. So that seems remarkable. Lithium was used heavily prior to the 1990s, but due to the fact that it could not be patented, drug companies lacked the motivation to promote or research the drug. In the 1900s, Depakote was introduced and became another successful drug to combat bipolar disorders, although not as successful as lithium. Lithium accounts for 80% of prescriptions for bipolar disorders and brings in an annual revenue of $43 million a year. Meanwhile, Depakote brings in roughly $1 billion annually. And that's because Depakote is patented and drug companies are making huge killings off of Depakote. Meanwhile, lithium, which is 80% of prescription for bipolar disorder, is only bringing in $43 million, but it doesn't cost that much. Lithium, here's some history about lithium. It was discovered by a man named August Arfvedson. I looked this up because I had no idea how to pronounce it, and I still don't. In 1817. However, for therapeutic purposes, it was made the discovery in 2nd century AD. It is hard to make a claim which individual noticed it first because a huge amount of the drinking water had it in it. Dr. Cade was the first doctor to notice monumental effects it had on bipolar patients, but actually it's found in many rivers. Lithium carbonate is found in many rivers and was taken for centuries without anybody noticing that it had a unique effect in them. The reason lithium is not more highly prescribed is because of the lack of awareness by doctors. The negative attributes turn some treating doctors away from the drug, and they lack awareness of that Depakote is at equal level of moderate risk to equality with lithium, meaning Depakote has just as many problems as lithium does. So it's hard to believe the doctors don't know this, but apparently they don't. Doctors are stupid. The reason lithium is not more highly prescribed is because of the lack of awareness by doctors. The negative attributes turn some treating doctors away from the drug, and they lack awareness. Okay, we already said that. Seroquel is considered an antipsychotic and prescribed for bipolar disorders. Antipsychotics are also known as neuroleptics or major tranquilizers. They are used particularly to manage psychosis, which manifests itself in delusions, hallucinations, or thought disorder. If some of the newer antipsychotics don't work, such as Seroquel, Zyprexa is not used anymore. Seroquel is one of the newer ones. Zyprexa is still used, but it has so many problems with it. But Haldol is still popular, but it causes something called tardive dyskinesia. And this is a movement disorder. And Seroquel can... there's been claims that antipsychotics can be attributed to Parkinson's disease. The type of antipsychotics that are normally aligned with medications such as lithium or Depakote. These type of antipsychotics are normally aligned with medications such as lithium or Depakote. So Seroquel would be put with lithium or Depakote, for example. Treatment seems to be beneficial among patients who take both an antipsychotic and a mood stabilizer, the greatest potential for a positive outcome. Many researchers claim that added benefits are non-existent as the level of antipsychotic dosage reach excessive levels. It seems its potential levels off at a particular point, meaning for some odd reason, when you increase these drugs to an extensive level, it doesn't become better. It just stops. It just cuts off at a certain point. In conclusion, patients gave a high score to the level of success of Seroquel at combating bipolar disorder. Similar to the mood stabilizers, the drug is effective in many of the same ways, such as combating onset of bipolar disorder depression. So mood stabilizers are also used for bipolar depression. Similar drugs that are used in antipsychotic field are Abilify, Risperidol, and Zyprexa. The greatest concern for these group of medications is the monumental weight gain attributed to the drugs. They can also lead to diabetes too, and therefore clinicians and patients must take precautions to make sure weight is under control. Exercising and proper food consumption is recommended, but isn't it always? Anyway, I think we have psychothemia. One or two more videos left on bipolar disorder. Psychothemia is the next one, I think. One of the next ones. Anyway, thank you.